This story is part of Fungi Week, a deep dive into the myriad ways mushrooms and fungi make the planet a healthier place for all its inhabitants. It is supported by UPIC Health. Only day, psychologist Brian Palkey watched one of his patients travel back in time. Palkey, a clinical mental health provider in Portland, Oregon, is licensed in the state to facilitate sessions where people take a dose of psilocybin, the psychedelic compound found in more than 200 species of mushrooms. His time-traveling client was haunted by trauma from his youth and has struggled with depression through his life. What psilocybin enabled the patient to do, says Palke, is inhabit his childhood memories. Over the course of 6 hours, the man revisited distressing moments from his childhood and had conversations with adults who had shaped his early years. People had never been able to speak within that way before or without ever leaving the treatment facility. He was experiencing all of this as a child, but at the same time he brought with him his adult consciousness, says Palke. It helped him to have a lot of compassion for his younger self and then, indirectly, for himself today. Palki is among a growing body of practitioners and researchers exploring psilocybin as part of mental health treatment. The psychedelic compound has already been shown to provide effective treatment for some forms of depression. Now the field is rapidly expanding, with hopes that psilocybin may also offer alternative treatment for conditions ranging from anxiety and obsessive-compulsive disorder to substance use disorder. So far, clinical researchers and practitioners in states that have recently legalized psychedelics, Oregon and Colorado, are finding promising results. The use of mushrooms with psychedelic properties dates back millennia. Psilocybin and other compounds were incorporated into the cultural practices of many indigenous peoples. In the mid-20th century, scientific research began to explore psychedelics, but that was largely abandoned by the 1970s. More recently, the potential of psilocybin and similar substances to address mental health has come back into the spotlight, not least with Michael Pollan's 2022 Netflix series How to Change Your Mind, based on his book of the same name. Psilocybin works on serotonin receptors, the same neurotransmitters targeted by medications that treat conditions like depression and anxiety. Those medications tend to work by blunting emotions. Psilocybin, on the other hand, throws us into our emotions, according to Palki. Weighed down by negative news, our smart, bright, weekly newsletter is the uplift you've been looking for. The compound creates a bit of chaos that removes some of the filters that are usually at work in our brains. Parky goes on to explain parts of the brain that don't usually communicate much talk to each other. Some people say they hear colors or see sounds. These novel connections can also help people break out of rigid patterns of thinking common to many mental health conditions. For those undertaking psilocybin therapy, the hours-long experience of actually taking the drug is just a beginning. In the weeks and months after, the brain is fertile to form new neural pathways. This means that people may find it easier to start or stop specific habits, including developing new patterns of thinking that can relieve mental health symptoms. That is an opportunity right then to get some momentum in a chosen direction that a client wants to go in, Pargi says. To date, most studies have focused on the impacts of psilocybin in relation to depression. One study looking at severe depression, which is characterized by rumination, found that a third of participants experienced a significant reduction in depression 3 weeks after a single 28 mg dose of psilocybin coupled with therapy sessions, although adverse effects were also noted. Another study tracked people after 2 psilocybin therapy sessions, finding that depressive symptoms remained lower for a year after the treatment. While there isn't yet the same kind of concrete data when it comes to the impacts of psilocybin on other mental health conditions, a significant amount of work is currently underway to get to that point. As of September, there were more than 150 active trials in the US looking at psilocybin for OCD, clinician burnout, complicated grief, even neurological disorders. Over the past 2.5 years, Oregon and Colorado have legalized the adult use of psilocybin. Credit 24K production Shutterstock. So far, no psychedelics have federal approval for mental health treatment, but the findings on depression have prompted excitement and a desire to understand the potential of psilocybin when it comes to treating mental health conditions beyond depression, says Cody Winther, a pharmacologist leading research into psychedelics at the University of Wisconsin-Madison. Winther is particularly interested in how psilocybin works with stress. Many mental health conditions, including anxiety and PTSD, are connected with stress, so better understanding how psilocybin interacts with stress could help extend treatment options for more mental health conditions. Winther's lab has found mice that show highest levels of anxiety early after a dose were the least anxious 4 hours later. The findings indicate that in order to see mental health benefits from psilocybin, says Winther, people might need to take enough of the compound that they have a significant experience. In other words, can someone benefit from psilocybin without tripping? Winther's mice, as well as other research, suggests not. While research into psychedelics is in early phases, Wenther believes psilocybin could soon offer a new path for mental health treatment. Psilocybin, it's not actually new, he says. It's just a new way of engaging with it. And I think that's exciting because we know there's a lot of people out there who need help. We know how clinical trials are ongoing. Some people, like Parky's time-traveling patient, are already seeking out psilocybin for mental wellness in states that have opened up legal systems, like Oregon in 2023 and Colorado earlier this year. In contrast to clinical trials, which are limited to